Tina. Thank you, Tina, for letting us share your video today. We're going to be doing a little bit of filler under the eyes and a little lip plumper and define little creases, yes?
Yes.
And then we're going to trim a little eyelid skin.
Mm-hmm.
Do you feel that relaxing medicine a little bit?
I think so.
Yeah. Makes you feel a little goofy. We'll give it some time. I had one of my patients, because we're going to do the eyelid, I had one of my patients tell me that relaxing medicine, I don't feel it, not one bit. Like this, so. Now, if you happen to be somewhere in the United States where it's freezing cold, we're in Florida where we got flamingos, so I'm wearing our my flamingo suit. This is the before, right? So we're going to trim some of that eyelids, get in fill. How long have you been thinking about having something done, Tina?
A little bit of time.
What was holding you back?
I'm scared.
You're scared? You're going to do great. You've been watching our videos. If you've been watching the videos, you know we're going to take good care of you. So right now, I'm going to do a little cleanse on the skin. And let me get my white pencil. Because when we do the Sculptra, that's right in through here that we're going to build the little valley. Here and through here. And yeah, I'm going to focus under the eyes with the Sculptra and then the lips with the lip plumper, okay? Sound like a plan?
Yeah.
Very good. You said your friends wanted to watch you have it done?
Yes.
Are they going to get upset if we make you look younger than they do?
Yes.
Okay, so for the physicians and students that are watching, I like to use Hibba Cleanse for cleansing the skin and alcohol. It's very rare that you're going to have two large gloves only.
Okay.
It's very rare that you're going to have a reaction or a infection from the filler. Let me have you rest your head all the way back. So a little cleanse on the skin. And of course she's taking the relaxing medicine because we're doing the eyelid treatment. We're going to take the extra skin. Traditional eyelids, you don't need to take skin, muscle, fat for everyone. We just take the skin, you leave the muscle, you leave the fat. And it's safer and less recovery and less risk that way. So that's the Hibba Cleanse, now the alcohol. And Ari has everything set up perfectly, and Yesenia is our camera person today. Thank you guys. So now, when I do the numbing, I'm going to scoot this over to the side here. So I do the numbing for the lip, and I'm going to lift the lip here. You can close your mouth. There you go. And then you're going to feel buzz and pinch. 1, 2, 3, pinch. You feel small, medium, big pinch, not too bad? Little pinch. So we'll go slowly. How about there? Small, medium, big?
Yeah.
So just a little bit of numbing here. Everything's looking good. How about there? Small, medium, big? Small little pinch. This is a modified dental block. Modified labial block, really. And when you're submucosal, you feel a little pinching there?
Mm-hmm.
Patients, if they feel a little pinch, it's like they're not jumping out of the chair. You just feel a little pinch and then it goes away. How about here? Small, medium, big pinch? Not too bad? I'm injecting about 1/10 of a cc every 10 seconds, so it's actually pretty slow. But that way it's more comfortable. So she feels a little pinch there. So we're going slowly here. How about there? Small, medium, big pinch? A little bigger. So we're going to take a moment. How about now? Pinching?
Mm-hmm.
Small, medium, big?
Mm-hmm.
How about now? Tell me what you're feeling there.
Feel like big lip.
Feels like it's a big lip. Now that's just the numbing medicine. Are you feeling any pain right now?
No, nothing's happening.
Me neither. I'm just kidding with you. Okay, let me lift your lip just a little. Go to close your mouth. Over here, do you feel a little pinch or not really? You feel buzz, and then you'll feel a little pinch there. Big, deep breath in and out. If you're watching, you should take a big, deep breath in and out. We're on a mission to stop bad plastic surgery. We're going to show you how to do it the right way. I feel that the labial block here is better than the topicals. It's definitely more comfortable. How about there? You feel pinch or not really?
We're located in Tampa and the Villages.
Tampa and the Villages. Look us up at imagelift.com. If you want a consultation or you want pricing, call us 813-463-9245. You can go to imagelift.com/pricing. And we have our wish list there that you can sign up for. And then I'm just going to put a little bit right in here. 1, 2, 3, pinch. Little pinch there. So she feels that. How about now? You feel small, medium, big pinch. What are you feeling now?
Nothing.
Everything's looking good. Little pinch there. How about now? Small, medium, big, nothing?
Nothing.
You see the eyebrows go up, I say. She feels a pinch there. How about here? Pinching? Small, medium, big? Does the buzzer help a little bit or not really? The buzzer does help. The brain can only focus on so many things at one time. How about here? A little pinch? So the buzzing helps. And I'm just going slow. When you go slowly, the lidocaine has a chance to take effect. And you really don't feel it as much. How about here? A little pinching? Small, medium, big pinch there or not really? A little bit. Little tiny pinches. If we say, you know, I feel a pinch, it's a little pinch, it's not a big deal. We just go slowly. Everything's looking good. I'm watching the eyebrows. If the eyebrows raise up too much, then we take a break. So we'll take a little break there. Okay. How about now? You feel pinching or not really? Little pinch here. You can relax your brow. There you go. Big deep breath. How about here? Pinching? Little bit? Little pinch there. So let's go slowly. So by the way, when I'm injecting, this is what I look for. I can see the facial expression. And if I see too much facial expression, then I need to slow down and stop. Okay. How about now? Do you feel pinching? Okay, let's take a break. Now your lips are going to feel numb and big and swollen. But that's just the numbing. Are you feeling any pain at all? Okay, so now we're going to test, and go ahead and close your mouth for me. Do you feel a little bit of a pinch here, a little pinching? Not too bad? Little pinch here? So I'm just giving some extra numbing, and I'm also testing, because I want to make sure she feels comfortable. Little pinch there? Little pinch, or not. Same thing here. How about here, pinching? Little pinching here. Okay, so blotting. You always got to blot because the patient will feel like that they've got some drool there, but there's no drool. You feel buzz, and on the cheek, you feel pinch. 1, 2, 3, pinch. Or a little pinch. Do you feel small, medium, big pinch? Large. How about now? Tell me what you're feeling. Not too bad? Okay.
Anna asked, what are you doing?
We're doing lip plumper, and we're also doing some Sculptra. You feel buzz and pinch. 1, 2, 3, pinch. Don't move her face, please, Art. How about now? Small, medium, big pinch? And then you'll feel that settle. So now I'm going to let those settle in. So the ABCs of plastic surgery are really important because when you know the ABCs, you will make your best choices. Now I'm just going to start with the little creases here. And I'm just priming the, there we go. Do you feel a little bit of a pinch there or not really? A little bit there. You can see where the lip creases are going to come if you pucker the lips. Purse your lips like you're going to whistle. A little bit there. Now here you're going to feel a little pinch on 3 here. 1, 2, 3, pinch. We'll go slowly. We'll just put a little bit in there. The corner of the mouth is important because that's where we get like a little bit of a downturn. Very good. Are you feeling any pain at all, Tina? Me neither. So just fill in those little tiny creases. little pinch here or not. So fill in the creases. Now I'm going to do a little plumping for the lip as well. And you'll feel pinch here, 1, 2, 3, pinch, little pinch, a little bit of numbing. Perfect. So now I start with a vermilion border, and this is the safest technique because it's just submucosal, and as you can see, there's very little, almost no bleeding. Feel a little pinch there. Now how about pinch and a little bit of numbing? Over here, do you feel pinch or not so much? So this is just the vermilion border. How about here, a little pinch? And this also helps to spread some of the numbing medicine. Everything's looking good. And then massage that straight away. So for the lip plumper, you pass the grocery store test the same day. Ari, you're a little close there. I don't want you that close when I'm pointing this at you, okay? You can walk into the grocery, nobody does a double take, okay?
Is it done?
We're getting closer. Everything's looking good. Feel a little pinch there. So plumping, ABCs of plastic surgery. When you know the ABCs, you'll make better decisions. A is for area. There's 4 areas that we address for the facial appearance. If we sag, we tighten. If we lose volume, we fill. Sun damage, wrinkles, and sunspots to the skin, we can polish and repair the skin. The 4th area is better than everything else, and that's our behavior. And nothing looks as good as Mother Nature. You can close your mouth. Nothing looks as good as Mother Nature's free facelift when we smile. The smile always looks the best. There it is. Now relax as best you can. So, there's A for area. B stands for boundaries. What are the rules, the boundaries for good plastic surgery and good cosmetic treatment? Safety is always first. You must look natural. Let's prevent future aging, and let's get as much improvement as possible. We can't make things perfect. We're not God. We do the best we can. If we need to come back another day and do more, it's better than going too far. C stands for combination. If we want our best results, we combine. We combine tightening, volume, and skin gets the best results. If we want our best results, but we just want one treatment, then we talk about tightening, and that's what we're doing today. We're doing some tightening around the eyes. Best results, no downtime, fillers. Now, fillers do a great job, but they don't give us a lift. And lifting, I get wonderful results, but I can do even better when I combine. So if you know those 3 categories of combination treatments, solo with tightening, and then fillers, if you're happy with your results, great. But if you want more results than what you've achieved, you can always come back and do more or take the next step. So it's predictable what your treatment plan can be. Tina, how about here? You feel a little pinch or not really? Everything's looking good. And I love doing lips for patients because it looks natural. They love them. There's no restrictions. Tina, how you feeling, dear? Doing okay? And just a little tiny bit in the corner of the mouth. Perfect. Very good. You feel a little bit of a pinch here, or not really?
Mm-mm.
Thank goodness for lidocaine. And how about here? Do you feel a little pinch?
Mm-mm.
Very good. So with Sculptra, Sculptra is a superior collagen stimulator. And I like to use that for the hollows we get under the eyes. You'll feel pressure, twist technique, twist, 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 twist. And then tapping. You'll feel a little numb and goofy under the eyes. That is normal to feel numb and goofy under the eyes. Shiver technique to put a very fine amount of filler over a large area. And Ari and Yesenia have everything set up perfectly. Thank you, ladies. And Yesenia is our camera person today. Tina, how you doing, dear? Doing okay?
Green.
Are you feeling any pain at all?
Mm-mm.
Was that a or a uh-huh? No pain. Okay, just checking. And uh-huh. Just different by the little H sound. Pressure pinch. You feel pinching or not really?
Pinching.
And you'll feel that go away. You feel it getting a little numb under the eye on the other side? Everything's looking good. How about here? Any pinching? Small, medium, big pinch? Medium? Small? Okay. How about now? Any pinching or pain? Very good. So the Sculptra is a collagen stimulator. You see a result right away, then it goes away. Pressure pinch, pressure pinch. Little pinch there. How about here pinching? Very good. So as you can see, fillers are pretty straightforward. Patients, you feel a little pinching there? It feels numb? Is it hurting? Okay, good. Yeah, I mean, patients, if a patient tells me that they feel a lot of pain when they've had filler somewhere, that breaks my heart, right? This is the way fillers should be. Remember, there are thousands of injectors out there, and most of them, they're beginners or intermediate level. So, you don't, but they're not going to tell you they're beginners or intermediate. That's why it's important that you have to be your own advocate. You let me. You feel a little pressure pinch here? There's no substitute for experience. There's no substitute for results. And we're glad that you can be here so we can help you raise your standards and do things the right way. We're on a mission to stop bad plastic surgery. If you're just now joining, I'm Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're here in Tampa and the Villages, Florida. If you have snowstorm, come down to Florida. We are very lucky with our weather here. If you are getting the COVID vaccine, we recommend it because there's no restrictions with fillers. Last I looked, there's been Almost 100 million in the United States vaccinated, so keep that going strong.
But I had Pfizer.
You had the Pfizer?
Mm-hmm. Shot one and shot
Did your arm hurt when you had it done?
Mm-hmm.
Yeah, my arm did not hurt one bit. But I didn't get the shot in my arm. Just kidding. Everything's looking good. Okay, last little bit. So what we're going to do next is we're going to trim some of that eyelid skin, so we will be back. And Ari's going to set everything up. Last little bit of filler, just some sculpture under the eyes. And what's great is you can see the result immediately. Now that goes away, and then the collagen is going to build over 3 to 6 weeks. And even at 2 months, 4 months, and 6 months, you'll see continued improvement. But this is the power to see what volume can do for you. Okay, Tina, why don't you open up your eyes? Can you see how that builds in the cheeks a little bit? And then the lips. Now, this is not your final product, right? How does it look so far? You got the value look. Can you see how it builds, it fills the little creases and plumps? And do you like what you see under the eyes? It's a little swollen. You don't want to taste the chocolate cake before it's done baking. Okay? So we're on track. And now we're going to do the upper and lower eyelids. Get any questions? It's hard to think of questions once you've had some of the Valium, right? It's like you had a few cocktails. All right. You did great. Congratulations. Thank you for watching. We have more videos coming soon. I'm Dr. Rich Castellano. We're in Tampa and the Villages. Give us a call. 813-463-9245. We're happy to give you a consultation and all the pricing and all of the details so you can do what's right for you. You did great. It looks